Hello. Today we will talk about liver cirrhosis and its symptoms. We will also learn about the importance of the liver in our body. And at the end of the video, I will tell you the foods you should consume for the good of your liver. What is the importance of the liver in our body? The liver is one of the largest and heaviest organs in the human body. It is located in the upper right part of the abdomen, just below the ribs. What are the functions of the liver in our body? With its spongy structure, it absorbs toxic nutrients entering the body and ensures that these nutrients are removed from the body. Thanks to hepatocyte cells, the liver works for both storage and transfer to separate food and blood. These cells perform a vital function and carry out their tasks in an organized way. This allows the liver to perform many tasks at the same time. The liver is a very powerful organ. It continues to function even when important parts are damaged. The liver can even repair and regenerate itself. However, there are some cases where it cannot repair itself. What is liver cirrhosis? Cirrhosis, also called chronic liver disease, is a very dangerous disease and refers to advanced liver damage. Different levels of liver damage can occur due to various diseases, sometimes for unknown reasons. As a result, the structural functions of the liver are impaired, and it becomes unable to perform its normal functions. This is the beginning of the cirrhosis process. As this process progresses, the liver begins to harden and shrink as a result of the reduction in functioning liver cells. Blood flow to the hardened tissues becomes difficult, and new vascular pathways form because blood cannot reach the tissue. All these events affect the liver even more negatively and aggravate the picture of cirrhosis. As a result, the liver cannot fulfill its function and liver failure occurs. What causes cirrhosis? One of the most common known causes of cirrhosis is chronic alcohol abuse. Apart from excessive alcohol use, one of the most important causes of cirrhosis is chronic viral hepatitis, such as hepatitis B and hepatitis C. Despite all research, no cause can be found in approximately 10–15% of cirrhosis patients, and this condition is called cirrhosis of unknown cause, cryptogenic cirrhosis. Consequences of liver cirrhosis. Cirrhosis of the liver is a progressive liver disease characterized by the chronic replacement of healthy tissue in the liver, by scarring, fibrosis. This prevents the liver from functioning normally and can lead to serious complications. This condition is very dangerous for human health, and people with symptoms of this disease should seek medical attention as soon as possible. What are the symptoms of liver cirrhosis? Cirrhosis of the liver is a serious liver disease whose symptoms can vary depending on the stage of the disease. In the early stages, symptoms may be mild or not noticeable at all. However, as the disease progresses and liver damage increases, more prominent symptoms appear. Here are some important symptoms of cirrhosis of the liver, and if you think you have these symptoms, you should consult your doctor immediately. 1. Fatigue and weakness. When the liver cannot function normally, there is a decrease in energy production, which leads to a constant feeling of fatigue and weakness. Fatigue and weakness, one of the symptoms of cirrhosis, greatly reduces the overall quality of life. 2. Loss of appetite and weight loss. People with cirrhosis of the liver often have a reduced appetite and may experience weight loss. Loss of appetite and weight loss are important symptoms of cirrhosis. 3. Abdominal pain and bloating. Damage to the liver is known to cause abdominal pain and discomfort. Abdominal bloating is also one of the symptoms. 4. Jaundice. When the liver is not functioning properly, yellow discoloration of the skin and eyes, jaundice, may occur due to the accumulation of a substance called bilirubin. Jaundice is an important symptom of cirrhosis and should be taken seriously. 5. Edema of the abdomen and legs. When cirrhosis of the liver leads to fluid accumulation in the body, it can cause edema in the abdomen and legs. It is a symptom to watch out for. 6. Itching of the skin. Some people with cirrhosis of the liver report itching in different parts of their skin. How is cirrhosis diagnosed? After the symptoms that occur in the formation of the disease are seen in people and complaints occur, a specialist doctor should be visited immediately. During the diagnosis phase, the specialist should be told the history of the disease, symptoms, and complaints. After taking a detailed history of the disease and symptoms, the specialist evaluates the situation and performs a physical examination. In these cases, hardening, enlargement, and marginalization of the liver, enlargement of the spleen and fluid accumulation in the abdomen can be detected by physical examination. Jaundice, edema, and bruising in different parts of the body are also among the diagnostic criteria that draw attention during the examination. In addition to physical examination, some imaging methods, ultrasound, blood tests and biopsy are performed, and the diagnosis of cirrhosis is determined according to the results. What are the treatment methods for cirrhosis? Liver cirrhosis is divided into 3 levels, A, B, and C, according to the level of progression of the disease. At levels A and B, in patients with less damage to the liver, regular physician control and treatment can minimize the progression of the disease and ensure a quality life for many years. The primary aim of the treatments applied by specialist physicians is to prevent the progression of hardened scar tissue in the liver and the complications caused by the disease. The most important treatment principle for cirrhosis patients is to avoid all kinds of foods that may burden the liver, unnecessary drug use, and alcohol consumption. If cirrhosis is of autoimmune origin, treatment with immunosuppressive drugs is applied, and if it is caused by viral hepatitis, antiviral drug treatment is applied. Level C cirrhosis. Patients with advanced liver damage may require liver transplantation upon physician recommendation. If you have cirrhosis, you can prevent the progression of the disease and improve your quality of life by having regular checkups and following the treatment principles recommended by your physician. If you are showing signs of liver cirrhosis, you should immediately make an appointment with your nearest healthcare provider and undergo an examination. With an early diagnosis of liver cirrhosis, treatment can be started as soon as possible to control the disease and prevent it from progressing to a stage that requires a liver transplant. In addition to medical procedures, consuming foods that have good effects for your liver will be very effective against cirrhosis. Here are some foods that are beneficial for your liver. 1. Artichoke. One of the most important liver-friendly foods is definitely artichoke. Rich in nutrients, artichokes contain significant amounts of vitamins A, C, and B, and minerals such as potassium, manganese, and calcium. In addition to these, the component called chiarrhine in artichoke supports the functioning of the liver, gallbladder, and biliary tract, kidneys, and intestines. 2. Coffee. Coffee has many positive effects on health, and one of the benefits of coffee is that it protects liver health. Scientific studies have shown that even in patients with existing liver disease, coffee consumption prevents the progression of the disease and supports treatment. The likelihood of permanent liver damage and cirrhosis in people with liver disease who drink coffee regularly and in moderation has been found to be significantly lower than in people who do not consume coffee. 3. Green tea. Green tea is a very valuable food that has been the subject of countless scientific studies in terms of its health benefits, and many benefits have been proven by these studies. Research has shown that the treatment of fatty liver disease, especially non-alcoholic fatty liver disease, is significantly easier in individuals who have the habit of drinking green tea regularly. 4. Garlic. Long known and consumed as a natural antibiotic, garlic also brings important benefits for liver health. Due to its antioxidant and anti-inflammatory effects, garlic prevents liver inflammation. 5. Grape. One of the liver-friendly foods is grapes, especially red and purple varieties, which contain a very useful component called resveratrol. Resveratrol, a very powerful antioxidant, provides a protective effect against many diseases, especially liver cancer and liver inflammation. 6. Peanuts. Peanuts are rich in choline, a very beneficial component for liver health. They also contain significant amounts of antioxidant compounds, vitamin E, and various minerals to protect the liver against cancer and infections and support its normal functioning. If you found this information helpful, subscribe to the channel to get more healthy and helpful content. Click the subscribe button and turn on notifications to be notified instantly about our videos. Thanks for watching. Don't forget to like the video.